My name is Jeffrey D. Cirillo. I'm a Regents Professor at Texas A&M College of Medicine and the Director of the Center for Airborne Pathogens Research and Imaging. Certain years, and this year has been a really bad year, we're seeing increase in water temperatures that are associated with propagation of the bacteria. So they grow really fast there, especially with all the rain and weather patterns that we're seeing lately, so we get a lot of runoff. And whenever we see a lot of runoff, we see more of these bacteria, so they come out. And then once they're in that environment, it takes them a while to go away. We'll probably have an issue with this for the rest of the summer into the winter. Vibrio vulnificus is the organism that's responsible for the flesh-eating bacteria deaths that we've seen. The Gulf Coast in general always has Vibrio. And Vibrio, this species of bacteria, lives in the environment. It's natural to the environment. The only thing that's really kind of changed is the temperature. So water temperature, as water temperature increases, as it's hotter, then we see more of these bacteria around. The other things that can increase the frequency of Vibrio in the water system is flooding and any types of major weather patterns like hurricanes and so on. So Florida, Louisiana, Texas, we all have Vibrio in the water. They're also normally on the coast. So out in the open ocean, we don't see a lot of Vibrio there. But in that brackish water, so between the fresh water and salt water, that border, that's where Vibrio lives. It prefers that environment. So we mostly see it along the coast. It lives within the mud. The term, the phrase of flesh eating, has to do with the toxins that it produces. So it causes this kind of degradation of tissue, so that your immune response, when it responds to things with those toxins present, will cause a lot of cell death in the area. And so we call it necrotizing, and that's really the flesh-eating aspect, in that the flesh degrades. And so you'll see where the wound is. Usually, so Vibrio infections in these environments, they occur 9 times out of 10 in wounds. So any type of puncture or cut or scrape where it's gotten this brackish water or the mud or shellfish, so particularly things like oysters and clams, things like that, they can carry Vibrio. Get into that wound, and then you'll see from that wound, you'll see a reddening. If it goes systemic and it's very life-threatening, you'll get a fever along with that. But you get a lot of swelling and then these kind of blistering associated with it that looks like a blood blister rather than just a regular blister. And that's where you'll see that degradation of tissue. So a darkening of the wound and then a spreading out. It'll continue to grow. I've seen cases where you see a punctured wound and then the hand gets like double its normal size. So that's that type of illness, and something you have to watch out for. Yeah, so the main mechanism is getting in is some sort of puncture or wound, and that's the primary thing that we see, especially with the life-threatening illnesses. But there have been cases from raw shellfish, so undercooked shellfish. So you have to be careful about that as well, especially from the Gulf Coast. We've had in the oysters, you can get Vibrio from that. So it can be life-threatening from that, but most of the time orally it's not as likely to be life-threatening. It's usually, like I say, associated with a wound, and then the cut gets infected. And that can be by direct inoculation, right? Working with a shell and trying to shuck an oyster or something and cut your hand. Or fishermen, people wading into the ocean, even at the beach, they can get it, they have a cut and they can get the wound infected. That's normally how it happens. It's very rapidly progressing. The bacteria replicates very fast. And the toxins it produced can have systemic effects. So it can get into your bloodstream and cause a life-threatening illness very quickly, within a matter of a day or two. So you need to seek medical attention immediately if you suspect this is possible. So having a wound, in general, we're talking about swelling associated with the wound. That's kind of unexplainable, more than normal, and also pain associated with it. Any type of, as I mentioned, kind of this necrotizing, so it'll look kind of like a bruise or a bloody blister that's spreading, anything that's increasing, and then, of course, any fever associated with it. Got to go to emergency room or urgent care immediately. So very rapid treatments necessary. So antibiotic treatment is the standard. We're looking partly for sepsis. So if they have a fever, that usually means that the bacteria has already gone systemic. So we may have to go to IV antibiotics, so treat systemically with antibiotics. IV antibiotics are faster than oral antibiotics. But the antibiotics are pretty standard. It's usually 2 antibiotics at one time. One of them is a cephalosporin, which is a pretty standard antibiotic that doesn't have a lot of side effects. If you don't have a puncture wound or other issue, I don't think there's a lot to worry about. Most people are not going to get infected unless they have an immunocompromised state. And all my children are healthy, so I'm not too worried about it. Let them have their fun. I don't think it's something you really need to worry about unless you do have an injury. And in those cases, you watch the wounds very closely. So some of the things that can be done, say a kid falls and in the rocks and looking in tide pools or something and gets a cut, that's obviously in the ocean, clean it well. So you want it to bleed a little bit if it's gonna bleed, but you also wash with fresh water to clean the wound out, and then come back in with soap and water to clean really well, and then make sure the wound is not exposed to salt water further. So you'd cover it. You can use an antibiotic cream or something like that, and just to make sure that the wound doesn't get further infected. But in general, most people, you're not going to see, even with a wound, occurring under that condition. If the wound is taken care of, covered well, cleaned up well, you're going to be fine.